in the OPD, there used to be two types of patients predominantly. One group used to come and say, "हमको ये बच्चा नहीं चाहिए." And the second group used to be, "हमको बच्चा चाहिए." And the couple got a child, that joy on their faces. I think that's where I decided that I want to help these couples.
I understand that having the same field, such a big benchmark in the family, must be a big pressure for you. At one point in time,
I was never the traditional mother. I was busy with my work. Small things like, he'll say, "Oh, I can't come today because I have my daughter's class." Hello? Work is work. What is daughter's class?
Like, she doesn't understand when I'm saying quality time over quantity time. Thanks to my mother's example, my daughters also learned how to spend quality time with me rather than quantity time.
So we started multiple centers, and I believe that if any woman or any man wants to multiply and everything, you should not be scared. Learn the business or learn the skill, learn the technique and own it, and don't be scared.
hello and welcome. We are here for ISAR's yet another podcast series. And today, the podcast is unique. It is rather generational. We are today talking with one of a kind mother-son duo, wherein we are going to know a lot about our field and dynamics of their relationship as well. So I would want to introduce Dr. Nandita Palshetkar, madam, and our dear friend Dr. Rohan. Welcome, madam. Welcome, Rohan.
Thank you, Neelam.
Thank you so much, Neelam. It's actually quite a challenge to be on the podcast with her around.
Yes, it's a challenge.
No, I think we really enjoy.
But our chemistry is generally good fun.
Yes.
So
We have a lot of fun, and I know you for so long. I'm sure we're going to have a blast.
And I remember my journey into MOGS.
You were the young
introduction.
one in my Emojis team.
Yes, and we thoroughly enjoyed that time.
but let's tell everyone that was more than a decade ago. Otherwise, they'll still think we're young only.
yes, that's true. Then came Dr. Rohan. He joined the bandwagon, and he kind of taken ahead the whole scenario in terms of our young talent promotion committee and
Very kind of you, Neelam.
lot of
Very
other
kind of.
activities. So I would want to ask you, when you started, like it was another era.
Absolutely.
That time the medias had to be prepared and everything had to be started from scratch. So let's look at the clinical aspect, wherein there are a lot of gynecologists, and you became a gynecologist from a prestigious college, and IVF was new, and the results were not very promising. The situation was not like very happy
Conducive.
and yes. Then what made you take and what made you go into IVF field?
Neelam, I still remember I was a medical student in JJ Hospital. And I was doing my MD gynecology. And in the OPD, there used to be two types of patients, predominantly. One group used to come and say, "हमको ये बच्चा नहीं चाहिए. It's an unwanted child. We want an abortion." And the second group used to be, "हमको बच्चा चाहिए." Infertility, this, that. And I used to feel, "अरे इधर से उठा के इधर डाल दो." These people are not having children. But then once, we treated at our level in JJ Hospital, and the couple got a child, that joy on their faces. I think that's where I decided that I want to help these couples, because you're making a difference to their lives. You're creating a family. So I think that was what made me. And at that point, remember one thing, it was like surgical. There were greats of surgery, who have operated, versus this was totally technology. Then contraception was a big thing, and here I wanted to go into opposite field of contraception. So I think it was very exciting for me. I am techno crazy. I am.
Yeah. I completely give you.
So I decided to take this road less traveled. Let's say that. And we were hardly 10 units in the country when we started it.
Don't worry, we've just expanded to about 5,000, 6,000 now.
Yeah, so that's where we come in. Like when you started, and I certainly remember that he wanted to do orthopedics.
Oh no, this story goes even back before that. Just imagine, I was what, 14 or 15, I think ninth or 10th grade. Which mother tells a 10th grader, bunk school, I need you to record something in my lab? You have to understand, we didn't have these cameras and everything that are those handheld cameras. So my mother wanted to record. So you're talking about back in like 2002 or 1 or something, where they want to put videos in
Even I
their
was a kid that
presentations.
time.
Exactly. They're trying to put the videos in their presentations, which was a big deal back then. Now, though, it's just a click of a button. So she made me come. She's like, Rohan, do one thing na. Aaj school bunker. Let's go to the lab. So I go. For me, imagine you're a 14, 15-year-old entering a lab. For me, that was technology. That was when IVF had already jumped up leaps and bounds over 10 years. Now, though, it's at another level. But I saw that and I'm like, what are they doing? Like, you're reading in bio what not a oocyte, but like what a ovary is, what a testy is. They're going one step further in. And I'm watching on the camera, the microscope's connected to the screen. I'm seeing that they're doing an ICSI and everything. And I'm like, okay, I'm floored by this. This is what I want to do. Well, and when you talk about my orthopedic journey, yes, I definitely wanted to do orthopedics. I think the best thing for me was she didn't push me to take gynae. She's like, "Kar, तुला जे करायचंय कर."
That was the best.
I think that's
I'm there with you. I told him I'll support you whatever you do.
So now when looking at a different era, so I want to know something wherein you suppose you have patients in your OPDs, and when your patients definitely ask the success rates of the IVF, and when they sit in front of you, madam, and when they sit in front of you, I mean, how do you actually make the person understand the science, give a realistic understanding of success, and does age matter in explaining and convincing the patient to go for the procedure?
I think, let me talk about myself. I think it's my years of experience. Definitely, I feel it does matter. And I talk about it, maybe, I'm more like a motherly figure. I will talk to them. I listen. I am a very, my consulting takes about half an hour. I mean, it's really long. I take the trouble to listen to people and everything. And maybe, I don't know, maybe, a lot of young people connect with him rather than with me. So I think it's a generation gap or something. But, like small things, like, he'll say, oh, I can't come today because I have my daughter's class. Hello? Work is work. What is daughter's class? That's my thinking. But your generation has to think of quality time for the child, for the this. And I'm like, bunk it. Work is more important. Yeah. So, I mean, my thinking is different.
No, but honestly, with mum, it's never a challenge. Honestly, for me, it's you do what you're trained to do. Like if you're doing a section a certain way, you've learned that from your senior. So I've learned my counseling. I've learned how to approach a patient through her itself. So for me, but I've realized that with the current generation, yes, they want the TLC, her favorite term, tender loving care. But at the same time, they want facts, they want numbers, and they want it to be quick. There's no question about now when we talk about, I know many people may not agree on this, but when you talk about the long agonist protocol, the ultra long agonist, I think patients now don't have the time, they don't want to wait. Like even now, I'm sure Neelam, even you must be getting so many patients saying that we don't have time to be with each other, but we want to have a kid. Let's just do IVF and finish it off.
Yes.
So
a lot of people come, I want twins, that's why I want IVF. That's another discussion.
It's sort of become like a Zepto or Swiggy sort of treatment if you go to look at it.
But also this young generation is not used to failure. I think we have mollycoddled them so much, you've protected them so much that when a difficulty comes, it's difficult for them to face it.
Yeah, empathy. I wouldn't call it mollycoddling. I think it's more about the empathy rather than the mollycoddling. I think that's one thing I've really picked up from you. I've realized that when you empathize with a patient, they are very comfortable no matter the result. I
Yeah.
think they understand that you're equally emotionally involved in that. Because I've seen her get upset,
Yeah, I've
even
cried.
with negative results.
So now, most important aspects of the practice which you have learned from each other.
From each other, I've genuinely, what I learned from her is most importantly was reading up. But being very honest with you, any new technology that comes in, if I know about it, is because the minute she reads it up, she'll text me. Articles on infertile sterile, it's in human reprod, it's in whichever journal. And if I don't have the journal subscription, she'll send me, she'll like log in, read it. So I think that's something what I've learned from her is to stay up to date daily. So that really gives me a this. Another thing we already discussed is empathy. I think it's very important to understand. She's like, don't get irritated na, with the patient. You don't understand what they're going through. They're like, when you are upset about something at home, you expect someone else to be empathetic towards you. What if it's your own? What if it was your own mother, your own wife, your own sister going through that treatment? Would you have behaved like this? And I truly believe that that's something that needs to be taught at a very early stage. In fact, this is not an IVF. She told me this when I was joining residency.
As a person,
She literally told me, she's like, just remember one thing, that woman who's there, firstly, you all don't allow the husbands in for the delivery. So when they're coming in, so they're all alone, they're scared. So that's why she told me that be empathetic, yeah. Don't get mad at them. They're going through pain. You're just sitting and waiting there for the baby to come out. Don't rush these things. And I think the third most important thing she told me was, listen, just work hard and love what you do. If you don't love what you do, na chod, take up something else. Because if you don't have that love or that passion, na, it's going to be work. It's going to be work. It's not, you're not going to enjoy it for the rest of your life. And I'm so glad finally she didn't push me into IVF. Well, she did a little bit, but not as much as I thought.
Intelligently.
Mother
Very
always
intelligent.
would want to-
Intelligently, I did
And
it.
the political background, father is politician. Thoda to she needs to know how to manipulate her own son at least.
Yes, and somewhere inside she must be feeling.
And let me
because
tell
this
you
is-
from him what I have learned. Unconditional love. Because I was never the traditional mother. You know, I was busy with my work. I would give, I was so guilty
Yeah.
that if he was coming back, I would give him 100 rupees to come by taxi. Not 100, 500 ka note I'd
100,
give
yeah.
him.
You forgot what
those
inflation
days.
was there that time.
So 100 rupees I'd give him. He needed only 2 rupees to come by
Six
bus
rupees,
and
6 rupees.
and 30 rupees to reach by taxi. So I used to hand over 100, come by taxi. This boy is his father's son. So, one thing that I learned from him was, we were an ASRM, I remember. And the Da Vinci robot I had seen it for the first time. It was there for the first time in the conference. And they were, people were sitting at it. So I told Rohan, you've just got into it. You must go and sit at the robot. He sat at the robot and everything. And then he said, Mom, you sit. I said, no. How can I? I mean, I can't even contemplate. He's saying, Mom, sit. And he made me sit, and it was like having your hands in the abdomen. The robo is so good. And, I was afraid of technology at that point. But he made me overcome that fear. And I'm telling you, after that, I've never said no or got worried about technology. I grab it full on and I get into it.
In fact, now she teaches me a lot about technology at times.
Yes.
In fact, I told her when I used the Da Vinci for the first time, this was I think 2011 or something, or 2012. I said, Mom, this is nothing but a PlayStation. Obviously, at that time it was on a simulator, but
True.
honestly, it just felt like you were on a controller. And in fact, since we're talking about on a scientific platform as well, there's a research paper which says that gamers make better surgeons because there's better hand-eye coordination.
Yes, correct. But now
So you've been gaming for 20 years.
Much longer,
Yeah.
35 years
Wow.
out of my 40.
long years. So now we are talking about AI, automation, vitrification, everything. But I would want to start the journey and then we will go towards Dr. Rohan where we are talking about this technology. How was it in the beginning?
Actually, Neelam and Rohan, you won't believe it. We had a room where there was a milky water system. So the water had to be prepared in that pure
media.
form.
Oh, you
Only
do
the water,
Create the
distill it.
distill
media.
water.
Oh my god.
And the whole room, there was a whole room which was the milieu system. ICSI needles, they're made of glass, right?
Yeah.
Okay, so we used to get glass pipettes, and over the Bunsen burner, we had to pull it.
Oh my god, like literally glass making. Like
Yes, and trust me, when I went, I think I was there in 1996 or something for training to learn how to do ICSI. I broke about 50 needles, and I said embryology is not for me.
I wasn't old enough to say, don't worry, you'll be able to do it.
But those were the days.
One thing, she's missing a very important story. Okay, so this is obviously when they sit together with the old gang
gangs.
or the old gang and discussing all of this. They used to do pickups at 1 a.m. because denudation and everything, and then they have to do ICSI at around 3:34. They had to do it at that time because at that time no anti-vibration tables, and there was a train which would cross which would cause vibrations. So the trains used to be shut from 1 a.m. to 5 a.m. So they had to do the pickup at 1 a.m. so that they could do the ICSI at 3:34.
Yeah, we really were
Like Sudesh Kamath, matlab, he used to come there at 4 a.m., do all the ICSIs and everything. Honestly, I've learned a lot from that man. I think he taught me a lot about my embryology. My knowledge of embryology comes from him. And more than the the theory part, he taught me the practical. He's like, your culture media, color badalta hai, kuch hota hai. So remember, the culture media is not good. You can you can keep it only for a week. Don't try to extend it further. Then the results get affected. He's like, whenever you enter the lab, first put your hand onto that laminar flow. Because just a simple thing is going to tell you whether the temperature is proper or not. And once I actually did that and it was overheated. So we had to turn off the lamp and things like that. So I think we lost a gem way too early. But I genuinely miss him even now. Because I used to go and do cases with him all the time.
True. Heartfelt tribute to Dr.
Yeah.
Sudesh Kamath.
I know.
So now we are talking about time zone wherein you entered, but that time there were a lot of things changing for you also, madam. Because I think, can you talk about the era of OHSS and now what is the conflict between fresh and frozen embryo transfers?
You don't give me nightmares. I've had such cases where there was a cerebral venous thrombosis.
Wow.
There was, I think, pleural taps that we used to do by the dozens. And there was no AMH to guide us. Remember that. And sometimes patients used to do this day 2 sonography somewhere else. And people were not that into it that they would not count the small follicles, only leading follicles. 9-10 millimeter follicles will be counted.
Sure.
And then trigger leke aate the. Oh my God. I am so grateful. I can sleep in the night. I think
I've handled maybe a total of 2 cases of OHSS till date. I can't even, for me, I literally have to think that we would have to read up theory to handle a proper severe OHSS
yes,
case.
because we don't see it.
you
with
know
all
something.
freeze.
Remember, I had a patient, a doctor's wife only. She was a dentist, or I don't remember. No, she was not a dentist. A doctor's wife, and she took the GnRH analog. The long protocol, and she developed pleural effusion. They went to diagnose it as tuberculosis. This, that. It was just OHSS.
True.
She was a severe PCOS, but there was no, we know she was PCOS, but it was the flare up which FSH, LH it causes at the beginning, caused the OHSS in her. Can you imagine how sensitive she was? I mean, some of them are horror cases.
And
that
how
bad.
difficult it was to do an IVF practice then.
Exactly.
And why there are thousands of centers now, because the
But
risk,
the
risk
anti-
management, safety profile
With
has
antac protocol, what do we have to worry about? You have the option of that HCG trigger and
so
the
I would
agonist.
want that conflict between two of you. That
No conflict.
What is the conflict about?
No, we do have conflict. Come on.
So the points of conflict, maybe clinical, or if you have some conflicts about how many branches he would want to go more branches, or he would
No,
want
No,
to-
that is never
me.
conflicting. That's her. I have to tell her, stop traveling so much.
She's the entrepreneur.
Oh, I love my passion
No, for
job.
me, I think our biggest fight is deciding dosages.
Yeah. You know what? Listen, I come from an era of OHSS. Remember that. So I'm more conservative. Even if the patient has 3 or 4 follicles, she's thin as a reed. 16 BMI, I will say give GnRH analog as a trigger. Because I have seen these girls with 3 centimeters ovary and 4 centimeters ovary going into OHSS with just 3 or 4 follicles. So I think that's where the conflict is. And then the BMIs are high.
Obviously, we've come from a very different era of IVF. I think because we've probably never seen that many cases of OHSS who have probably gotten that bad where we've had sleepless nights.
True.
So
Yeah.
I think because of that, I think we are more aggressive in the sense we want to try and get more follicles. We're trying to achieve that success rate. And obviously, at the same time, I have very big shoes to fill in as well.
Yes.
So because of that, I'm always trying to get better results than her. Rarely happens, but
That's the-
but
that's the-
see, it's a good competition to have.
Yes.
I've got a good benchmark to reach up to. I always believe
You're
that.
there, don't worry.
Now you're my mother. You have to say that.
No,
I'm just kidding.
I don't think so.
But basically,
I'm proud of you.
She is my benchmark. She is my target, which I want to reach and cross.
So, passing on the legacy is something which we are talking about, and I understand that having the same field, such a big benchmark in the family, must be a big pressure for you. At one point in time,
It's a double-edged sword, definitely. Like, I'm sure you've heard the term of nepo babies and nepo
Yes,
going
I was
around
going to
enough.
ask you.
I said, let me only bring it up before I put you in that dilemma. Should I use that word or
no,
not?
I was going to ask you about the nepotism criticism, which everybody
but
feels.
see, that's expected. Listen, it's not my fault she decided to do so well, yeah? Matlab,
Correct.
she,
And it's not your fault that
No,
you want to aspire.
it's nobody's fault. I don't blame saying that, yeah, fine. I do get a platform, a bigger platform from where I have to start off from as compared to people who don't come from a medical background, which is completely fair. But there's only so much that platform can take you ahead.
Correct.
See, if you don't work hard, if you're not going to work hard,
Not good.
you're not
skilled.
good, you're not skilled. There's only so much she can do, yeah, that
True,
will progress me further.
True.
But it's eventually what my skill, my abilities,
And hard work.
of course, hard work is without a doubt there. But it's all of these things which are eventually going to make sure that it's not that platform I'm waiting at, I go further on. So I'm not even saying that I've touching that platform yet where she is. I think I'm like miles away. Like, she is
That's very modest of you.
No. There's no question about it. It's going to take me hopefully only another 10-20 years to reach there. Not longer.
Can I
But
interject here?
Of course.
Can I?
Of course.
Yes.
Listen, if any parents you ask what do they want their child to do well. Anywhere. Forget doctors or anybody. I think it's a basic human,
It's human nature.
want that you want your child to do better than what you did. Now, just because we are in medicine, look at businesses. Don't they put their children in the same business as this?
Correct.
Anything, any profession.
Yes.
So I don't think, I mean, I'm lucky that he took my profession. But even if, say, he had taken orthopedics, I would still be there right behind him and give him tips of how to improve his practice.
Correct.
I mean, come on. Wouldn't you do it for your child?
Yes, and everybody would do even for their students. Anybody who comes
Yeah,
to get
we
any
mentor our- we
guidance,
give our
we have been
students a
mentored to a
platform
lot
to
of
take
people.
off.
Lots of
Yeah.
doctors have been.
So many kids, I've brought them in the Mumbai OBGYN Gynec Society. I have brought them in Foxy. I've brought them in ISAR, IAG, and they're doing so well. Just because I'm not their mother doesn't mean anything.
Yes.
So I think I'm a type of a person, or any leader for that matter, takes people and grows together.
And I think at the end of the day, my takeaway from all of this is just be happy, be positive, and enjoy everything that you're doing.
Now I come to the question wherein, like, today's time, like, I am seeing IVF since last like 14 years, and I feel now, if we're reading the data that US, UK, people are talking about more rush mindset into IVF from IVF doctors, and there is a problem from patient side wherein they are having overestimation of the result. So, how the times have changed, especially for you, madam, because that time when you gave a baby to somebody, they used to look at you like a god.
Absolutely.
Now it's mere service.
Not really.
I will
Not
disagree
really.
with that.
Not really.
I would want your points
I
on
would
that.
disagree with that to an extent.
You know, when we began, the success rate was like 10-15%. So, our pregnancy ali ki we used to celebrate.
Yes.
When the first 10 patients became pregnant, it was like a festival celebration because the success rates were so low. Today, it's different. You know, we're having. But I feel that the patients are really grateful. They are very happy that they are pregnant and they actually treat you maybe not like God, but somewhere closer to God.
Yes.
And
Affection is
there
more.
are there are a few Nastic people now who don't believe in God, so they
Don't
won't
look at
treat you
me.
like
Don't look
God.
at
They won't treat you like God because they don't believe in God. No, but believe me, people are happy. What is your
people
take?
I still have patients who come with their kids on their first birthday to cut the cake. I'm sure, Neelam, that happens with you also.
True, a lot.
Huh?
A lot.
Yeah, so the entire point is at the end of the day, we're all, I think it's still there. I think it's just a different way that we are now perceiving it. What used to happen back then was because the success rates used to be only 10 and 15% or 20%, they used to be more happy about that positive result.
Yes.
I think
Now-
it's the other way around, that we are unhappy about the negative results, we're not happy about the positives.
Correct. Because that's expected. That's where I was talking
Yeah,
about.
so I
Like,
think our mindset needs to change more than
Yeah,
the patient's
patient
mindset.
Absolutely.
Correct. And what do you say? Like 2012, 11 patients who you have done, they have never declared about their IVF to the society.
Even today.
Even
Now, today still a little bit more
no,
percentage.
Yeah, percentages may have increased.
They're
I
putting
think
it
too
on
much.
YouTube.
No,
I'm taking the jab.
The only reason why people start talking about IVF is when they have twins and everyone feels that twins are only through IVF. But I'll be very honest with you, I generally don't think it's as
still feel it
open
is a
as it
stigma.
is.
not at
No.
all.
What is your message to your fellows and your colleagues when you are looking into new technologies? Like, how much is enough at current point, 2025?
Just saying how much technology is enough.
Yeah, AI, automation.
I'll be very honest with you. I believe use everything and give everything available. Discuss pros and cons with your patients. It's important to understand where to cut off the technology rather than where to use it. Like, there's no point in thinking of AI in a 26-year-old with just a bilateral tubal block, ovarian reserve is normal, you've got good sperm count, but there is, for some reason, the tubes are blocked. I believe that it's important to discuss with your patients because we're in a different time zone now. It's not like when they were back in practice where you said, ye karo, patient would do it blindly. Now patient will ask you, why do you want to do AI?
Correct.
Why do you want to do IMSI? Why do you want to do PGTA? They're asking you questions at each and every step. So I think we are still in very nascent features of AI. I think even today, I think AI just helps in counseling when you need to explain to them what's the quality of the oocytes, what are the live birth rate chances, what is the chances of a blastocyst formation. So in that manner, it's great. But at the same time, I think it should be used with caution. I want her viewpoint on this.
I believe in using whatever technology is there, whether it's a 26-year-old or a 35-year-old. But of course, even like him, I today counsel my patients. I give them the pros and cons of the technology, but I offer it. Okay, because people come back and say, oh, why was I not offered? I don't think you need it. No, I don't think that is the answer. Today, if you have that tool, I think it's very important that you offer it. Of course, you use it judicially. See, everything depends on your counseling, no? Now, if I tell a 26-year-old, oh, this will make a great difference, she'll believe me and do it. But if you tell her that, look, I have this technology, but I don't want to use it on you because I don't think it'll value add. So I just differ from him that way, that you should inform your patient that these
No,
are
I'm on your side. We're not
these
differing.
are
We are both on the same page.
These are the technologies that we have, but personally, with my 35 years of experience, I feel blah, 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 blah. So I think it's very
So,
important.
When you are making a decision for a patient, what madam is trying to say, that mention that I am giving it a thought of this also to you, but I am ruling
But
it
I
out.
would, respect your decision.
Because if a patient wants to do artificial intelligence, because now we're in the era of chat GPT, like, no, I want to use artificial intelligence. Who are you to deny? It's a matter of consent.
So we were talking about the conflicts, and we have understood that there have been more or less you have come together on consensus forming, but I'm sure there must be some more conflict.
Oh, I love it.
Let me put this in more recent terms, not recent, but more than a decade ago, when I was giving my MD exams. I was studying, I got fried. I was like, I just call her up at like 2 in the afternoon. I'm like, where are you? So she's like, I'm in OPD. I said, shut OPD. I'm fried. Come. Drops OPD, gets into the car, comes to Navi Mumbai, takes me out for lunch, explains infertility ka chapter to me over lunch. I said, listen, I can't read infertility now. My head is hurting and all. Just tell me quickly, upar say what I'm expected to know. And she's going into MCX. I said, listen, this is not even written anywhere in my textbook. You tell me what clomiphene does and what letrozole does. I need to understand that first and then we'll get into the rest of it. So these are small things that she did, which for me, that's where I understood. So when she says that, why don't you, like she doesn't understand when I'm saying quality time over quantity time, because I think the children right now expect the quantity in their early childhood and then over time. But now I think, thanks to my mother's example, my daughters also learned how to spend quality time with me rather than quantity time.
True. And being there at the right moment and
yeah,
I don't know, it's uncanny how I reach at the right time, at the right. It's
good karma.
It's good karma,
Blessings.
probably.
Yeah.
Because, my
Blessings from
mother,
up.
True.
my father, whenever, I can't sit in a hospital with them, but whenever there was something that needed to be taken, decision to be taken or something, I was right there.
So after doing so many, like having so many real life experiences, and we deeply appreciate that you are letting people know about these experiences, and that is where the greatness starts. So I want to know about your Young Talent Promotion Committee work, which you have been doing and we have been following.
So I'm technically now a registrar chairperson, as in my third year of my chairpersonship, about to give my MS exams in 2027, as we would say. But it's been a very good journey in terms of, see, we always think in terms of the society that we're just doing CMEs, we're doing this. But what doesn't go into our understanding about what the organization is about, what are all the policy making decisions, how the policy making decisions come into play, how it's not a, how do you say, anarchy, it's more of a democracy about how it goes ahead, how it opens up avenues for you to understand future leadership roles. Like a chairpersonship doesn't open up doors into understanding what Foxy is about, but it gives you a base understanding of, like, a simple thing. Like now when I've worked as a chairperson now for 2 years running, what I have learned is the positives and negatives from each of the presidents that I've worked under. But for me, what I've realized is I want to pick up the positives and mold them from myself. Even in her presidency, the one thing I realized was listen to everyone. You never know who's going to give you an idea, whether it is a person who's just passed out or still giving MS, or to someone who's been in Foxy for 50 years. You're going to get some knowledge or the other. And also one more thing that I've realized through Foxy is you need to understand each and every step that you go forward. Like now when I'm organizing, now I've been doing a lot of public awareness programs for sex education for boys, because that's something that's never been covered by most of the society. We always look at educating the girl. We've always said beti bachao, beta padhao. So I've actually taken that beta padhao part and implemented. We've actually done sex education for close to around 3,000 boys over the last year. I started this campaign this year. And we've actually we've reached out to them.
Any unique experiences you had in that series of those?
For me, the first city that I actually conducted this program was with Ekika Singh from Mau.
Yes.
Okay, she actually it was actually her brainchild. I have to say that. She is the one who actually said that I want to do something. I said, this is fantastic. Let's go ahead with it. She's like, let's do it in Mau first. Now, Mau is a tier 3 city in UP. For me, I said, if it runs well there, I think it's very scalable, because I was really scared that I'm talking about sex education. So what we did was we went to 2 schools in the morning. We did it. What I was most surprised was how open the students were about asking questions. We took it for children from 6th grade to 10th grade.
Wow.
So we actually spoke to them about what masturbation is, what sex is, what an erection is, what are good habits, exercise, healthy eating. It wasn't just about sex. It was about overall growth. And then after that, I had like the younger kids actually says, how will I know if it's true love? That was one of the questions that I had gotten, and I was a bit stumped. I'm like, okay, I really don't know how to answer this.
I know.
I genuinely don't know how to answer this. Like, I can answer the scientific ones about how many times masturbation is bad, what is addiction, everything. I'm like, now I really genuinely don't know how to answer how to find true love. So these were some unique, but what I loved is even with the 3,000 kids that we spoke to, we had a lot of conversation about understanding the different. Like, I've done one in Chandrapur, I've done one in Sindhudurg, I've done one in Mau, we've done in Varanasi, I've not gone personally to all the places, but I've done about 5 camps myself, and we've done about 10 other camps through the other committee chairs. I've got Apurba Kumar Datta also, who's been working with me, who's done programs, Jyoti Banglowala, who's done a couple of programs for me, Prerna Keshan, who's been doing programs with me. So what I've also realized is giving the youngsters an opportunity. I'll tell you one thing. Through this YTP committee, what I've realized is, or rather I should tell what I've realized from her is, give the credit to anyone who does even the smallest of work. Someone who's gotten and given you a pencil, it's okay, give them the credit. Because if you appreciate what they're doing, they are more energetic, they're more motivated to do further work. So I think that's been something. And I'll be honest with you, we've got fantastic talent. Okay? I've got Nepo kids and non-Nepo kids in my committee.
I come in the second category.
But I'll be very honest with you, all of them work so hard because they know that they've got a platform and they all want to make use of it. I've got people, I've been publishing newsletters. In fact, there's a newsletter coming out every month now called the YTP Chronicles, which is basically articles written by seniors and by juniors. So that gives them an opportunity to publish. Because now when we are writing articles and all, I'm usually second author to my mother. But
sorry.
No, but it's okay. I probably would have not got this opportunity if it wasn't for you.
So a lot, and my heart is filled with the affection both of you share. I would still want to know a little bit more because the times are changing. The law was not there.
Yeah.
The law has come. And I would want Madam to talk more about how do you look at the law? Law is needed, that we know. But how do you look at the practice change and what are your comments about the legal aspect?
I think, yesterday I was on a podcast actually. So they said, the success rates, are we equal to the West in success rates and in technology?
No, we're not. We're better.
I think
Better? We are better.
no problem. But I think, yes, we have kind of reached there. And there is only one thing, which is regulation, which is not where we are, where they are. Okay. And the law puts that into place. And I'm sure, see, it's in a very early phase. They're still setting up cells and everything. So I think by the time everything gets streamlined, we should be there. I think regulation is something which our country needed. And actually, yeah, it's like the MTP law. It was switched after 20 years. By the end of 20 years, finally, it's something that we are happy about. So the law is going to evolve, it's going to change, it's going to become more doctor friendly and patient friendly, I feel, as time goes by and as technology evolves. So, you know what? Let me also tell you something. I think the fact that I was practicing in Bombay, and in those days I was getting a lot of patients from Delhi. So we thought, let's start a center in Delhi. And then one thing led to another. Delhi made a lot of patients started coming from Punjab. So we started there. We started in Bangalore. Then we provide service. I'm a vagabond. I cannot sit in one place.
She can't.
I
was
bored.
so stressed out in COVID, but I was quite pleasantly surprised.
So we started multiple centers, and I believe that if any woman or any man, I mean boy, child, wants to multiply and everything, you should not be scared that we are not business people. We are not into finance and all those. Don't be scared. Be determined. Learn the business or learn the skill, learn the technique, and own it, and don't be scared.
See,
I think that is very important. And that's how we proliferated and multiplied into so many centers. And his take is totally different. No?
I don't know whether I should be saying this on public forum or not, but being very honest, I believe that you put in so much hard work, you put it in, and as you said, Neelam, that earlier it used to be like they used to treat them like God, and now it's become more like a service. Might as well have private equity come in.
Correct.
That's my viewpoint, and
Correct.
they differ from me.
Monetize your practice.
I said, you work so hard, you might as well monetize it, and there's no harm in it. And I tell her, I'm like, worked like crazy for the last 35 years. I genuinely don't
more
think.
than money, I feel the happiness and happy high which a independent clinician gets, the name recognition which
Look at his
they
expression.
get.
Look at his
Let me just put it
expression.
this way. I think everyone's allowed to differ in their opinions.
Yes,
Let's-
Whether we
accept
agree,
your opinion.
disagree, I
Let's
think.
agree to disagree.
Yeah, let's put it that way. See, because I look at it this way, that the quality of life now, when we used to say that 60 to 63 is the age of retirement, I disagree completely. Firstly, I think at 75 is when you can start calling them senior citizens. Honestly, even till date, I see so many of our senior gynecologists with such active lifestyles.
True.
Whether they're practicing or not is a different thing, but they are still extremely active.
Yes.
No, most of them are practicing.
No.
Right
No,
till
I-
80,
they're active, they will
90.
I'm not-
practice.
No, but I agree with that. For all the CMEs and all that I go for, they've shut down evening practice. They practice only in the morning.
Yeah.
Things like that. They're active. So, but they enjoy doing that. So, I don't call senior citizenship, I think, till you've crossed 75. So,
The other day in Bangkok, they said, are you above 70? Then you classify as senior citizen, not above 60. So I think the world is also adapting to our...
So being very honest with you, I think beyond a point, there's only so much that you can do. So why not monetize it? But it's okay. It's been great.
Thank you so much. And this was such a smooth and such a flowing conversation I had with both of you. It will be etched in my memory forever. Thank you so
Aw,
much.
that's
Neelam,
so sweet.
the only reason it flew so smoothly was because you were a fantastic moderator over there.
Oh my
you just
God,
made
thank
it very
you.
easy for us.
Thank
But
you.
thank you for
Thank you.
having us here.
Thank
And it was an interesting set of questions which you asked. So that got us really
Yeah.
into the...
Yeah, we were actually wondering, I'm like, do I have to study ICSI and then debate with my mother on ICSI?
Sorry, that's a lost cause.
Yeah, of course it was. I'm like, there's a no-win situation here. What am I doing? But yeah, Neelam, I really enjoyed the conversation.
Thank
Thank
you.
you
But
for
I would
having
really
us.
like to end with one quote which my father has always taught me in life. And I think it's important, especially if there are any youngsters watching it.
Absolutely, I agree with that.
Yeah. Ego is the death of life. And death of ego is life. Really. I think one should be, not have that ego to let you pull you down. I think on that note, I would like to end.
Yes. And here we say in Marathi, we say Thambala to Sampala. So we have seen the journey of from the starting, and I never saw you, madam, stuck at one point. This is what we are doing. You always looked into what is new, how we can adapt, and that is something which you, in not knowingly, unknowingly, has imbibed in all of us who are following you.
Oh, thank you.
So we all owe it to you for the progress we have done, and for the updated IVF field we are running in Mumbai, all of
Yeah,
us.
yeah.
So
Yeah, I'm proud of all of y'all.
Huge
Y'all are
respect
doing
to
so
you for
well.
that. Thank you so much, ma'am.
Thank you.
Researches which are done in the labs, they don't hit the clinics. But your work has always had a clinical impact for the patients.
First thing you'll see asking me often in our meetings is that, okay, imagine that if I have this test for you, would you use it for your patient? If I'd probably not done that, not published that paper, maybe, I don't know, AMH might not have come as a test for where the government does have a positive attitude towards researchers. And I think it's changed a lot since the time of COVID. Based on our work, the decision to vaccinate pregnant women was taken.